introduction, and I'm going to talk about part of the consensus, which is about the oral therapy during Ramadan for people with diabetes having type 2 diabetes. And this is a publication. The publication is in an important journal, the Current Diabetes Reviews, and it is 2024. And this is the topic, risk stratification in people with diabetes for fasting during Ramadan, a consensus from the Arabic Association for the Study of Diabetes and Metabolism. And those are the professors sharing in this hard work: Inass Shaltout, Amr Abdel Wahab, Amr El-Meliki, Hani Hamad, Shireen Abdel Ghaffar, Atif El-Bahari, Nasser Taha, Nihal Hamdi El-Sayed, Amr Gad, Layla Hammouda, Shayma Abdel Maboud, and Amin Roshdi Seliman. All are dear professors. Sorry to say the names without saying professor or assistant professor. The current international guidelines recommend a pre-Ramadan risk assessment for people with diabetes who plan to fast during Ramadan. However, a comprehensive risk assessment based recommendations for the management of type 2 diabetes during Ramadan is still controversial. Therefore, the Arabic Association for the Study of Diabetes and Metabolism developed a consensus to provide further insights for risk stratification of people with diabetes who intend to fast during Ramadan. Risk stratification is a cornerstone for guiding people with diabetes whether to fast or not to fast. And despite of the many publications and research related to Ramadan fasting, the risk stratification for fasting remains controversial. Let me start with the oral therapy. And since Ramadan has significant potential for metabolic changes, the risk of hypoglycemia is increased during Ramadan, among other risks like hyperglycemia, dehydration, and thrombosis. And some classes of medications are associated with higher hypoglycemia and dehydration risk. In return, adequate risk stratification for type 2 diabetes receiving oral antidiabetic medications who intend to fast during Ramadan is crucial, and medication adjustment may be needed. Let me start with metformin, and metformin is known to have rare hypoglycemic events, and when it is used alone, it can be used safely during Ramadan with no dose adjustment. And this is just the change in timing during Ramadan. If the patient is taking once daily dosing, then it's taken during with iftar. If the patient is taking twice daily dosing, and larger dose can be taken with iftar and smaller dose with suhoor, or divided. If the patient is receiving the prolonged release metformin, then the medication should be taken with iftar. The sulfonylurea act by stimulating the beta cells of the pancreas to secrete insulin. So there is incidence of hypoglycemia with certain types of sulfonylurea, especially older generations of sulfonylurea. So a major concern related to sulfonylurea during Ramadan has been issued, and the risk of hypoglycemia varies among different sulfonylurea, and we are having newer versions of sulfonylurea. Many studies showed that there is incidence of hypoglycemia, especially with glipenclamide. Up to 20% of cases had hypoglycemia in some trials, and glipenclamide causes hypoglycemia more than the other two sulfonylurea, known sulfonylurea like glimepiride and glyclazide. And in Virtue trial comparing vildagliptin with sulfonylurea, also glipenclamide caused 31% hypoglycemia compared to other sulfonylureas like glimepiride and glycoside. More recently, preferred sulfonylurea are better with lower hypoglycemia like glycoside MR, and we had the study Ramadan, which is a large real-world international study on more than 1,200 patients, and glycoside modified release caused 2% comparable to placebo hypoglycemia, and there was no severe hypoglycemia in Ramadan study. This is the risk of hypoglycemia, and it is decreased in second-generation sulfonylurea like glimepiride and glycoside. This is a Ramadan study published many times, and I was one of the co-authors. And this is a study design 1 to 2 months before Ramadan and the months of Ramadan, and followed by 1 month after Ramadan. And this is a study outcome: 2% hypoglycemia due to glycoside MR, which is considered low incidence of hypoglycemia, and no severe cases of hypoglycemia, so it's considered safe to use glycoside MR during Ramadan. This is the change in dosing during Ramadan. If the patient is well controlled, it is recommended to reduce the dose of sulfonylurea, but if the patient is not recommended, we keep the dose of sulfonylurea. If the patient is taken twice daily, then give the largest dose with iftar and the smallest dose with suhoor. If it is given once daily, then it is given with iftar. If the patient is given 3 times sulfonylurea, we give 2/3 of the dose with iftar and 1/3 with suhoor. We come now to thiazolidinediones. Bioglitazone is the only member available, and hypoglycemic risk is low with bioglitazone. It does not exert its glycemic effect via stimulating insulin secretion. It's only potentiating insulin action. Vazan et al. Conducted a randomized controlled trial in India to evaluate the effect of bioglitazone during Ramadan. And the trial reported bioglitazone to be associated with incidence of hypoglycemia comparable to placebo. Then it is safe to use bioglitazone during Ramadan. Alpha-glucosidase inhibitors, and the risk of hypoglycemia also is low, and it is safe to use alpha-glucosidase inhibitors during Ramadan. But there is no published randomized controlled trials on alpha-glucosidase inhibitors during Ramadan. The prandial glucose regulators, the glinides, and they act by insulin secretion, also but short-acting. Many studies reported low to moderate risk of hypoglycemic episodes with individuals receiving ripaglinide during Ramadan. Mafuzi et al. Reported incidence of hypoglycemic episodes in an open-label randomized trial comparing patients receiving ripaglinide versus glimepiride during Ramadan, and the incidence of hypoglycemia was 2.8 versus 7.9, so lower risk of hypoglycemia. Anwar et al. Also compared glimepiride with ripaglinide, found similar symptomatic hypoglycemia. Dipeptidyl peptidase inhibitors, they are well-tolerable oral antidiabetic medications demonstrating low risk of hypoglycemia, actually a minimal risk, and a number of trials was done on different members of DPP-4 inhibitors, sitagliptin and vildagliptin, and in large trial, more than 1,000 patients, switching the medication to sitagliptin from sulfonylurea, and the other arm remained on sulfonylurea. The group receiving sitagliptin had lower risk of hypoglycemia compared to sulfonylurea. Another trial, the Virtue trial compared vildagliptin with sulfonylurea, and in vildagliptin group there was no incidence of severe hypoglycemia compared to sulfonylurea group. The sodium glucose cotransporter 2 inhibitors, and despite their well-established efficacy, some safety concern with SGLT2 inhibitors during Ramadan, and this concern is dehydration, especially for those patients receiving loop diuretics and also in older age. Few studies evaluated the safety of SGLT2 inhibitors during Ramadan. Some of them found a low risk of hypoglycemia of dapagliflozin than sulfonylurea, and the Kratos trial demonstrated reduction in hypoglycemic risk with SGLT2 during Ramadan, and SGLT2 then can be used during Ramadan, but taking consideration with the risk of dehydration and also maybe risk in older population, and this medication should be taken 2 to 4 weeks at least before Ramadan. This is a Virtue trial, and I was one of the co-authors. And this is hypoglycemic risk. It was reduced in the arm receiving vildagliptin and no severe hypoglycemia. This is the study on sulfonylurea compared with sitagliptin. And this is our summary of recommendation written in the consensus. Patients on treatment with diet and other lifestyle measurements are considered a low-risk group and can fast safely during Ramadan. People with diabetes receiving metformin, alpha-glucosidase inhibitors, thiazolidinediones, and DPP-4 inhibitors are categorized as low risk and can fast safely during Ramadan. People with type 2 diabetes using second-generation sulfonylurea and Glinides are considered among the moderate risk group and can fast with medical assistance. Except for patients using glycoside MR, they are considered among low-risk group and can fast safely during Ramadan. Glipenclamide should be changed for people with diabetes who intend to fast during Ramadan, and patients on SGLT2 inhibitors are considered among the low-risk group and can fast safely during Ramadan, provided they are started at least 4 weeks before Ramadan. And this is the consensus table. For moderate risk, there is no very high risk or high risk for oral antidiabetic medications, but for moderate risk, individuals on second-generation sulfonylurea except for glycoside MR, and individuals on prandial glucose regulators, which are Glinides. The low-risk group are, like we said, individuals on diet and exercise and other non-hypoglycemic medications, metformin, alpha-glucosidase inhibitors, thiazolidinediones, and DPP-4 inhibitors, and individuals on stable doses of GLP-1, Professor Amr will talk about injectable, and individuals on glycoside MR, and individuals on SGLT2 inhibitors. And let me finish my presentation with this fatwa. The fatwa was taken from Dar al-Ifta, Fadilat al-Mufti, in 2008, when we started working on Ramadan. And fatwa, al-Islam samih jiddan for people with diabetes who cannot fast or they are at high risk during Ramadan, then they are exempt from fasting. Thank you very much. Ramadan Kareem.